Hi everyone, so my name's Tom, I'm a doctor working out of the UK, and today we're going to be talking about adenosine. So firstly, let's look what they're used for. So they're principally used for the management of narrow complex tachycardias, which are also known more commonly as supraventricular tachycardias, though there are some subtle differences. This is quite a broad topic, and we won't go into it in too much detail today, we'll save that for another video. But the basic premise is that it's a tachycardia which is originating from either the atria or from high up in the conduction pathway above the bundle of his. They can be broadly split into either a regular or an irregular rhythm, and each has slightly different management, so it's important to determine what the underlying cause is. However, I'm sure you can see from the ECG on the right, sometimes this can be particularly challenging. When the rate is so fast, you lose that fine detail, and this is where adenosine can come into play. So, with adenosine, we have two goals in mind. One, we either want to terminate the abnormal rhythm and hopefully fix the problem, but if we can't do that, we want to try and unmask the underlying rhythm by inducing a transient atrioventricular block, hopefully so we can work out what the underlying problem is. Alright, so now let's look at the mechanism of action behind this. So adenosine is an agonist of adenosine G-protein coupled receptors found in the heart. Stimulation of these receptors causes several things. Firstly, it causes reduced frequency of spontaneous depolarization at the sinoatrial node. It also increases resistance to depolarization. And this results in a slower sinus rate and conduction velocity, and it also causes this transient atrioventricular block. Now here we've got an example of a supraventricular tachycardia, and then you can see where an individual has written adenosine. Adenosine was given, you have that transient AV block, and hopefully you work to reset the heart and restore normal rhythm. Alright, so let's look at some adverse effects now. So these are typically all cardiac in nature because the primary site of action of adenosine is the heart. So the first one is bradycardia. So because you're inducing this transient AV block and because you're slowing the sinus rate, you will get a degree of bradycardia. Now, in those that are predisposed to bradycardias, as it is, this can potentially be prolonged, but in most people it's relatively short-lived. Secondly, we've got asystole. Now, because you're inducing this, again, this AV block, there is a chance that that might not resolve, and you induce an AV block, and that's it, they go into asystole. Because you're essentially stopping the heart for that moment where you're injecting adenosine, you get this sense of impending doom. So the way that a patient classically describes a heart attack, and you have this kind of crushing pain, you can have flushing and you can feel quite breathless with this. And people describe this as a really, really unpleasant sensation. However, fortunately, because the plasma half-life is only less than 10 seconds, the effects are unpleasant but short-lived. So there's a couple of patient groups where you should avoid adenosine. Now, for any hypertensive or unstable patients with a supraventricular tachycardia, you should be thinking about going straight to electrical cardioversion. Now, in any patients who really won't tolerate this transient bradycardia due to essentially a vulnerable heart, due to either a degree of coronary ischemia, decompensated heart failure, then really you should think carefully about whether you should use adenosine. Anybody with a second or third degree AV block should be really cautious about giving adenosine, as it may worsen their underlying block. In asthmatics, adenosine has been known to cause bronchospasm, so in those asthmatics that are on quite high levels of treatment, then you should probably avoid. It's also worth noting that you shouldn't use adenosine when the patient is also on dipyridamole, and some local anaesthetics, as this can significantly increase the effect of adenosine and worsen any bradycardias or risk of asystole. Okay, so now let's look about how you actually give it in practice. So, it goes without saying that you need continuous cardiac monitoring. These patients should already be on cardiac monitoring, but when you're giving adenosine, it is essential that you can have that rhythm up on the screen to see whether the drug that you're giving actually has any effect, and obviously to monitor adverse effects such as asystole. And as a result, you obviously need resuscitation equipment and a good team to hand in case that was to occur. So the way you give it is you need a large IV cannula, ideally as proximally as possible, for example in the antecubital fossa, and you give it quickly over 2 seconds, followed by an immediate flush. So normally the easiest way to do this is to get a two-way tap, such as you see in the photo. You give your adenosine and then immediately follow up with that flush, and the effect should be pretty instantaneous. So when we're thinking about dosing regimes, typically we start with 6 milligrams. Like I say, you give that instantaneously. You see if there are any effects, and you give it a couple of minutes. If there is resolution of the rhythm, fab, no further doses are required. However, if they're still in the abnormal rhythm, then you can give it 2 further doses at 12 milligrams each, with this 1 to 2 minute spacing. And then after then, I think about getting more senior help or thinking about electrical cardioversion. So hopefully you've reverted them back into a normal sinus rhythm and the patient is a lot less symptomatic with it. However, it's important to monitor them for a few hours afterwards just to make sure that they haven't switched back into an abnormal rhythm again. Now it's worth thinking about what the underlying cause of this abnormal rhythm was in the first place. Hopefully then we can think about stopping it from reoccurring at some point in the future. So that's everything for today. Thanks for watching and I hope you learned something. If you enjoyed it, please like, comment and subscribe. And again, hopefully bringing out lots more of these in the future. And we'll go produce a video on supraventricular tachycardias and the various types of rhythms, which we can go in more detail in the future. Speak to you soon.